When the Allied forces closed their grip on Tunisia during May of 1943, something extraordinary began to unfold that would challenge everything the captured German medical personnel thought they knew about their enemies. Nearly 275,000 soldiers from both Germany and Italy found themselves prisoners, and among those thousands were physicians, surgeons, nurses, and medical specialists who expected the worst. What they encountered instead would become one of the most remarkable and little-known chapters of the Second World War, a story documented through military records, personal accounts, and official reports that reveal how professional medicine transcended the brutal divisions of global conflict. The foundation for what these German medical officers would experience had been laid 14 years earlier, when nations gathered to establish the 1929 Geneva Convention. Those international agreements contained specific language about medical personnel captured during warfare, provisions that most German doctors assumed would remain theoretical niceties, easily discarded when actual bullets started flying. They knew how prisoners were treated on the Eastern Front. They understood the realities of total war. The idea that their captors would honour peacetime agreements seemed almost laughably naive as they surrendered in the North African heat, exhausted and defeated. What the German medical officers didn't yet understand was that the Americans took their international obligations with an almost legalistic seriousness. The Geneva Convention didn't just exist on paper for the United States military. Those regulations about equal treatment, about paying prisoners according to military rank, about officers not being compelled to work, about medical personnel retaining professional privileges and not being forced into non-medical labour. All of this would be implemented with a thoroughness that frankly exceeded anything the German medical system itself had managed even before the war. For men who served under a regime where rules bent to ideology and convenience, this rigid adherence to international law would prove deeply disorienting. The journey to America began on Liberty ships, those mass-produced cargo vessels that had carried American soldiers and supplies across the Atlantic. Now they returned with human cargo, sometimes as many as 30,000 German prisoners arriving each month at ports along the eastern seaboard, primarily New York and Virginia. The ships that would otherwise cross the ocean empty now served to transport defeated enemies to a continent most of them had only read about in propaganda pamphlets. The crossing itself offered the first hints that something was different about American captivity. Instead of being packed into cargo holds like livestock, the prisoners found themselves in actual passenger accommodations. They were served substantial meals, regular and plentiful, in ways that seemed almost obscene to men who had watched rations shrink month by month in North Africa. This wasn't kindness exactly, it was logistics, but the psychological impact on defeated soldiers who expected cattle cars and starvation rations proved profound. Processing through the port facilities moved with American efficiency, that industrial approach to organization that Germany had once prided itself on matching. Forms were filled out, medical examinations were conducted. Officers were separated from enlisted men. And then the distribution began, fanning prisoners out across a nation so vast that many Germans simply couldn't conceive of its scale. By late 1943, camps had sprouted across the American landscape like mushrooms after rain. Texas, with its climate and terrain deemed sufficiently similar to North Africa under the Geneva Convention's requirements, became home to a particularly large concentration of camps. The convention specified that prisoners should be housed in climates similar to what they had experienced during capture, a detail that seemed almost comically specific until one considered the lawyers and bureaucrats who had crafted such provisions thinking through every contingency. 3 new camps received authorization in 1943 alone. Fort Sam Houston in San Antonio started as little more than a temporary arrangement, 173 tents designed to hold 76 men each, housing both prisoners and their American guards in what amounted to a sprawling tent city. Camp Howes in Gainesville and Camp Hood North in Killeen followed. The medical facilities at these locations varied considerably. Some camps maintained only basic infirmaries, while others developed substantial hospital complexes, but even the most modest exceeded what German medical officers expected for enemy prisoners. They anticipated field hospitals at best, places to stabilize the critically wounded before moving them somewhere else. What they found instead were permanent medical installations with equipment, supplies, and staffing that suggested something closer to a regular military hospital. The truly significant revelation came not from the buildings or equipment, but from how American medical personnel actually treated their German counterparts. There existed documented cases, multiple accounts verified through different sources, of German doctors treating wounded American soldiers while American physicians cared for German casualties. This wasn't just some propaganda story cooked up for the International Red Cross inspectors. As a general operating principle, captured physicians found themselves treated as respected professional colleagues by their American counterparts. One American doctor reported years later that he and the German physicians worked together in a spirit of mutual learning, freely teaching and absorbing different medical procedures and techniques from each other. The concept seemed almost treasonous from a certain perspective, sharing medical knowledge with enemy doctors who might someday use it against American soldiers, but the American Medical Corps operated on the principle that medicine's obligations transcended national boundaries. The American medical establishment generally provided identical care to wounded German prisoners and Allied casualties. This equal treatment policy was not merely symbolic window dressing for international observers. German doctors were addressed using their medical titles, not as generic prisoners. They were consulted on difficult medical cases. They participated in medical discussions and case conferences. For men who had been fed a steady diet of propaganda about American decadence and racial inferiority, this professional recognition created severe cognitive dissonance. The Americans were supposed to be mongrel people led by Jewish financiers, incapable of building a proper civilization. Instead, the German medical officers found themselves working in facilities that exceeded anything they had known, treated with a professional courtesy that contrasted sharply with the contempt their own government showed for those it deemed racially or politically inferior. The medical facilities in these American prisoner-of-war camps represented a genuine investment in prisoner welfare that went beyond mere compliance with international law. Camp Butner's Convalescent Hospital alone treated nearly 14,000 patients during its operation. The facility didn't just provide medical treatment in the narrow sense. They offered comprehensive rehabilitation programs, social readjustment counseling, technical and exploratory training to help men prepare for post-war civilian life, vocational guidance for those who needed to learn new trades, and general education for those whose schooling had been interrupted by military service. By late November 1945, the staff numbered 2,200 people, assisted by 414 German prisoners of war who had volunteered for medical work. Patients recovering from serious injuries or illnesses received round-the-clock attention, the kind of continuous medical supervision that German military hospitals had struggled to maintain even before Allied bombing began systematically destroying Germany's medical infrastructure. These weren't segregated facilities where Americans received first-class care while prisoners made do with leftovers. The hospitals served both American military personnel and prisoners of war in an integrated medical environment where German medical staff worked alongside American colleagues. Wounded American soldiers lay in beds next to German prisoners. The same surgeons operated on both. The same medications went to whoever needed them based on medical necessity rather than national origin. The quality of equipment and pharmaceutical supplies available often exceeded what German military hospitals had possessed, even during the early war years when Germany still controlled most of Europe. X-ray machines actually functioned properly. Surgical instruments didn't need to be improvised from whatever could be scavenged. Medications arrived in sufficient quantities that doctors could prescribe based on medical indication rather than calculating how to stretch scarce supplies. German prisoners, including medical personnel, gained access to educational programs that would have been remarkable even for American civilians, let alone enemy prisoners. Almost every camp maintained a library assembled from donated books and magazines. Some collections grew large enough to rival average high school libraries in their comprehensiveness. Camp Fannin maintained a particularly impressive library, exceeding 2,500 books with an 80% circulation rate, meaning prisoners were actually reading these materials rather than letting them gather dust. For medical personnel specifically, this meant access to current medical literature and professional journals, resources that had become increasingly restricted in Germany due to both wartime conditions and the regime's censorship of medical research conducted by Jewish scientists or anyone else the government deemed racially undesirable. German medical journals had systematically purged references to work by non-Aryan researchers, creating gaps in medical knowledge that German doctors often didn't even realize existed until they gained access to uncensored American medical literature. Some camps established connections with American universities that created truly remarkable opportunities. An April 1945 report on Camp Butner documented 110 prisoners employed as mess attendants at Duke University and the University of North Carolina. While these specific prisoners worked in food service rather than medical capacities, the university connection provided German medical personnel in the camp with unprecedented access to American academic medicine. They could attend lectures when permitted. They could discuss medical topics with university faculty. They could observe rounds in university hospitals. These university connections, limited as they were by security concerns and the fundamental prisoner-captor relationship, represented a level of integration between enemy prisoners and American institutions that would have been utterly unthinkable under the government back home, where ideological purity always trumped professional or academic considerations. As millions of American soldiers deployed overseas to fight across Europe and the Pacific, the resulting domestic labor shortage eventually meant that German prisoners of war found themselves actually contributing to the Allied war effort, however indirectly, by working in canneries, mills, farms, and other facilities deemed minimal security risks. For medical personnel, this often translated into work assignments in hospitals and medical facilities where their professional skills could be properly utilized rather than wasted on manual labor. German medical officers who volunteered for medical work received compensation according to their rank and position, exactly as required by the Geneva Convention. The payment itself wasn't substantial by American standards, but it represented recognition of their professional status rather than treating them as a defeated enemy whose labor could be exploited without compensation. For men who expected to be treated as something less than human based on everything they had been told about their enemies, this formal recognition of professional standing affected them profoundly. The increasing numbers of German prisoners did present challenges that forced American medical personnel to confront their own prejudices and emotions. Initially, some nurses questioned whether they could actually put personal feelings aside and provide enemy soldiers with the best available care. Official policy in theatre hospitals clearly prioritized Allied casualties over enemy prisoners when resources were limited, which made practical sense from a military standpoint. Most American nurses discovered fairly quickly, however, that they were capable of viewing these German patients simply as human beings who needed medical care. They treated Germans with the same professional attention they gave anyone else who arrived on their wards. This professional integration occurred despite initial reservations and despite official policies that explicitly ranked Allied casualties above enemy prisoners. The ability of American medical personnel to separate their professional medical duties from national enmity and personal feelings about the enemy provided German medical officers with a working model of medical ethics that transcended political ideology and national allegiance. German medical personnel working in American camps witnessed an abundance of medical supplies that contradicted everything they had experienced during years of wartime scarcity. Basic medical necessities that had become precious commodities in German military medicine, simple items like bandages, antiseptics, and surgical instruments, were available in quantities German facilities hadn't seen since before the war began. This wasn't just about having enough supplies to get by. American medical facilities operated with the kind of material abundance that allowed doctors to make treatment decisions based purely on medical considerations, rather than constantly calculating how to stretch inadequate resources across too many patients. The pharmaceutical availability particularly impressed German medical personnel who had spent years carefully rationing medications. Sulfur drugs, which German military doctors had distributed with miserly precision, were used liberally in American facilities. The introduction of penicillin to some facilities by 1944 represented a therapeutic capability that German medicine simply didn't possess. German medical researchers knew about penicillin in theory, had read the early publications about this miraculous antibacterial substance, but German pharmaceutical production had never successfully scaled up manufacturing to produce clinically useful quantities. American factories were churning out enough penicillin to treat not just American soldiers, but enemy prisoners as well, a demonstration of industrial capability that drove home just how completely Germany had lost the production war underlying the military conflict. The medical treatment provided to German prisoners of war met or exceeded the standards applied to American military personnel, at least in stateside facilities far from combat zones. German wounded received the same surgical procedures, the same medications, the same rehabilitation services as American soldiers recovering from identical injuries. This equality of treatment, mandated by the Geneva Convention but frequently ignored in practice by most belligerents throughout history, was consistently applied in American medical facilities with a thoroughness that suggested genuine commitment rather than mere performance for international observers. German medical officers not only observed this equal treatment standard but actively participated in it, gaining experience with American medical protocols and ethical standards that would influence how they practiced medicine after returning home to rebuild their shattered country. Texas hosted such a large number of prisoner of war camps that the state became a center of the German POW experience in America. Camp Butner, located on approximately 40,000 acres spanning Granville, Person, and Durham counties in North Carolina, functioned as a combat infantry training facility where an estimated 30,000 soldiers prepared for deployment. German and Italian prisoners brought to Camp Butner served as cooks, maintenance workers, and in various other support capacities that freed American personnel for military duties. The scale of these installations and their associated medical components provided German medical officers with exposure to American military medicine at its most highly developed. The contrast with increasingly desperate conditions back in Germany became more stark with each passing month as the war ground toward its inevitable conclusion. The professional relationships that developed between American and German medical personnel, while obviously constrained by the fundamental prisoner-captor dynamic, nonetheless included genuine professional exchange and collaboration. American doctors learned trauma treatment techniques from German colleagues who had accumulated extensive battlefield experience across multiple fronts and years of combat. German doctors absorbed knowledge about American advances in antibiotics, anesthesia, and surgical techniques that had been developed during the war. These exchanges, documented in post-war accounts, military records, and personal memoirs, represented a level of professional collaboration between active enemies that was genuinely unprecedented in modern warfare. Previous conflicts had sometimes seen brief exchanges of medical personnel or wounded under flags of truce, but nothing approaching the sustained professional collaboration that occurred in American POW camps. The role of nurses in American military medicine provided German medical personnel with insights into fundamentally different approaches to organizing medical care. American nurses possessed more authority and exercised more autonomy than their German counterparts, participating in medical decision-making and performing procedures that in Germany were strictly reserved for physicians. This wasn't just about nursing practice, it reflected deeper differences in how American and German societies thought about professional hierarchies and gender roles in medicine. German medical officers working alongside American nurses had to adjust to this different professional structure, an adjustment that challenged fundamental assumptions about how medical care should be organized and who should make which decisions. Some adapted more easily than others, But the exposure to alternative models of professional organization affected virtually all German medical personnel who worked in American facilities. During the war, Fort Sam Houston made space available for up to 1,000 German prisoners of war starting on September 15, 1942, providing temporary housing while permanent POW camps were constructed elsewhere. Fort Sam Houston's reputation as the home of Army medicine and the center of combat medical training meant that German medical personnel housed there gained exposure to American military medical education and training methods. While their direct participation was necessarily limited by security concerns and their prisoner status, simply observing how the American military trained its medical personnel provided insights into different pedagogical approaches and educational philosophies that emphasized practical clinical experience integrated with theoretical knowledge. Dental care in prisoner of war camps, frequently overlooked in historical accounts focused on more dramatic aspects of the POW experience, provided another avenue for professional interaction between former enemies. German dentists among the prisoners worked in camp dental facilities, maintaining oral health for thousands of fellow prisoners, and in some cases treating American personnel as well. These dental officers experienced the same professional recognition from their American counterparts as medical doctors received. The American investment in prisoner dental health, providing routine preventive dental care rather than just emergency extractions when teeth became infected, demonstrated a commitment to comprehensive prisoner welfare that exceeded the minimum requirements of the Geneva Convention. This attention to seemingly minor health issues like dental care sent a message about how seriously Americans took their obligations to provide proper medical care for prisoners. German medical officers participated in public health measures within the camps, work that included disease prevention, sanitation supervision, and health education for fellow prisoners. These activities exposed them to American public health approaches that emphasized preventing disease before it occurred rather than just treating illness after people got sick. This preventive philosophy contrasted somewhat with German military medicine's necessarily heavy focus on battlefield trauma and acute injuries. The demonstrable success of systematic public health measures in maintaining camp health, despite crowded conditions and populations drawn from across Germany and Italy, provided practical demonstrations of how effective well-organized preventive medicine could be. The American approach to mental health treatment particularly affected German medical personnel who witnessed it. Combat fatigue, what would later be understood and termed post-traumatic stress disorder, was recognized and treated as a legitimate medical condition deserving proper psychiatric care rather than being dismissed as cowardice or moral weakness, which was the prevailing view in German military medicine. German psychiatrists and psychologists among the prisoners observed treatment methods that included psychotherapy, occupational therapy designed to help patients process trauma, and pharmaceutical interventions when appropriate. This comprehensive and relatively humane approach to psychological casualties contrasted sharply with German military psychiatry's often punitive approach to soldiers who broke down under combat stress, men who were frequently treated as malingerers or cowards rather than casualties deserving medical care. As the war finally ground to its conclusion in 1945, German medical personnel faced the prospect of repatriation to a homeland that had been bombed into rubble. Many had spent 2 or more years in American custody, during which they had practiced medicine under conditions that often exceeded what they had known as free physicians in Germany even before the war. The food had been better, the facilities had been superior, the equipment had actually worked, the supplies had been adequate, and they had been treated as professional colleagues rather than as ideologically suspect intellectuals who needed political officers looking over their shoulders. The repatriation process included medical examinations and health certifications conducted jointly by American and German medical personnel, a final professional collaboration that reinforced the collegial relationships that had developed during the years of captivity. After repatriation, approximately 5,000 Germans eventually emigrated to the United States permanently, and thousands of others returned later to visit places where they had been imprisoned. Many American farmers recalled their prisoner laborers with genuine admiration and even affection, maintaining warm friendships that persisted across decades and the vast ocean separating their countries. Among these maintained relationships were professional connections between medical personnel who had worked together during the war. German medical officers who returned to Germany brought with them extensive knowledge of American medical practices, organizational methods, and ethical standards that had impressed them during captivity. While the direct influence is difficult to quantify precisely without access to comprehensive personal papers and institutional records, their impact on post-war German medicine was significant, particularly in areas such as medical ethics, patient rights, and professional standards that had been corrupted or abandoned under the previous regime. German medical personnel's exposure to American medical education methods influenced how post-war German medical schools approached training new physicians. The American emphasis on practical clinical experience integrated with basic science, rather than treating them as separate phases of education, provided a model that some returning German medical officers advocated for in rebuilt medical schools. The systematic approach to residency training, where young doctors progressed through structured programs with clear expectations and regular supervision rather than the more haphazard apprenticeship model that had prevailed in German medicine, represented another American innovation that German medical educators began adopting. Several German medical officers who had experienced American captivity became prominent figures in post-war German medicine and medical education, though establishing direct causal connections between their POW experience and their later teaching methods remains historically challenging without extensive access to personal papers, correspondence, and institutional records that might document these influences explicitly. The experience of German prisoner of war medical personnel in America is documented through various archival sources that historians have pieced together to reconstruct this story. Official military records preserved in the National Archives contain administrative documentation of camp operations, prisoner assignments, and medical activities. International Red Cross inspection reports provide external verification of conditions and treatment. Post-war memoirs and oral histories from both German prisoners and American personnel offer personal perspectives on the professional relationships that developed. Contemporary newspaper accounts, both American papers covering local POW camps and camp newspapers that prisoners published themselves under American supervision, provide additional windows into daily life and attitudes. These diverse sources, while providing valuable insights into this remarkable chapter of military medical history, inevitably leave many questions unanswered about the full extent of professional relationships and knowledge transfer that occurred during those years. German pharmacists and pharmacologists among the prisoners gained exposure to American pharmaceutical practice that extended beyond just having access to more medications. They observed mass production techniques that produced consistent, high-quality pharmaceutical products in quantities that dwarfed anything German industry had achieved. They learned about quality control standards and testing procedures that ensured pharmaceutical safety and efficacy. They saw distribution systems that could get medications from factories to field hospitals efficiently. This knowledge about pharmaceutical production and distribution proved valuable after the war, when Germany faced the monumental task of rebuilding its pharmaceutical industry from the ruins. The availability of medications in American camps, everything from basic aspirin to advanced antibiotics, demonstrated production capabilities and supply chain management that had given the Allies an enormous advantage in treating wounded soldiers, an advantage that went beyond superior tactics or weaponry. The exchange of surgical knowledge between American and German medical personnel represented one of the most immediately practical aspects of their professional interaction. German surgeons, many of whom had spent years operating in field hospitals under combat conditions, shared trauma treatment techniques developed through bitter experience treating horrific battlefield injuries. They knew how to work quickly, how to prioritize when faced with overwhelming numbers of wounded, how to save lives with minimal equipment and supplies. American surgeons shared recent advances in anesthesia that made operations safer and more tolerable for patients, improved aseptic techniques that reduced infection rates, and systematic approaches to post-operative care that improved recovery outcomes. This bidirectional knowledge transfer, while inevitably limited by language barriers and security constraints that prevented completely free exchange, nonetheless enriched both medical communities and likely saved lives on both sides. German medical technologists and laboratory specialists among the prisoners worked in camp laboratories conducting the routine diagnostic tests that supported camp medical operations. These personnel gained experience with American laboratory methods, equipment, and quality control standards that frequently exceeded capabilities in German military medical laboratories, even before Allied bombing began disrupting everything. The systematic approach to laboratory medicine in American facilities, with standardized procedures rigorously followed, regular equipment maintenance and calibration, and comprehensive record-keeping, provided working models for post-war German laboratory medicine development. Small details like proper equipment maintenance schedules and systematic quality control procedures, easily overlooked aspects of laboratory work, made enormous differences in diagnostic accuracy and reliability. German radiologists and X-ray technicians among the prisoners operated equipment in camp medical facilities, gaining hands-on experience with American radiology equipment, whose reliability and image quality impressed personnel accustomed to maintaining increasingly deteriorating equipment with scarce replacement parts. Keeping X-ray machines functioning in wartime Germany had become an exercise in creative improvisation as replacement parts became unavailable and electrical power grew unreliable. American equipment, properly maintained with adequate spare parts and reliable electrical power, demonstrated what diagnostic radiology could achieve under proper conditions. Safety protocols in American radiology practice, including radiation protection measures for both patients and operators, exceeded German military medical standards that had been developed before the full dangers of radiation exposure were completely understood. This exposure to systematic radiation safety influenced post-war German radiology practice as returning radiologists advocated for proper safety equipment and procedures. The International Red Cross played a crucial mediating role in the experience of German prisoner of war medical personnel. Red Cross inspections verified that medical personnel were being treated according to Geneva Convention provisions, including appropriate professional recognition and suitable work assignments that utilized their medical skills. Red Cross packages supplemented medical supplies in some camps, though American military medical supply was generally adequate enough that these supplemental supplies played a minor role compared to their importance in camps elsewhere. More significantly, the Red Cross facilitated communication between German medical personnel and the international medical community, maintaining some connection to broader medical developments and professional networks that helped prevent complete professional isolation. Many prisoner of war camps published newspapers written by and for prisoners, publications that were subject to American censorship but generally allowed considerable editorial freedom as long as content didn't threaten security or promote the ideology of the former regime. These newspapers included medical and health content written by German medical personnel, articles covering health education, disease prevention, medical news, and professional topics that provided German medical personnel with platforms to maintain their professional identity and share knowledge with fellow prisoners. These camp newspapers, preserved in various archives and collections, provide valuable insights into German medical personnel's perspectives on their experience, what they thought was important, what they worried about, and how they understood their situation. Some German medical personnel, though in limited numbers, were permitted to conduct medical research while in American captivity. This research necessarily focused on non-sensitive topics that wouldn't compromise American military medical secrets, studies such as nutritional deficiencies among prisoner populations or disease patterns in camp environments. The ability to conduct even limited research with access to laboratory facilities, statistical support, and time to properly design and execute studies exceeded what many German medical researchers had available in wartime Germany's progressively deteriorating research infrastructure. Maintaining research skills during years of captivity meant these scientists could resume productive research careers more quickly after repatriation, rather than facing the prospect of years spent relearning techniques they hadn't practiced during the war. Disease outbreaks in prisoner-of-war camps, inevitable when thousands of men from diverse backgrounds lived in close quarters, required coordinated medical responses that brought American and German medical personnel together in urgent collaboration. These epidemic responses, whether dealing with influenza, gastrointestinal infections, or other communicable diseases, demonstrated American epidemic control methods and public health response protocols. German medical personnel participated actively in these outbreak responses, gaining practical experience in epidemic investigation, containment measures, and mass treatment protocols that would prove valuable in post-war Germany's challenging public health environment, where destroyed infrastructure and massive population displacements created ideal conditions for disease outbreaks. German medical officers observed American medical supply management systems that ensured consistent availability of medical materials through systematic inventory management, maintained emergency stockpiles, and operated efficient distribution networks. The systematic approach to logistics, treating medical supply as a science rather than an art dependent on individual initiative and improvisation, provided models for efficient medical supply chain management. This exposure to properly functioning medical logistics influenced German medical officers' understanding of how modern medical systems could maintain consistent supply even under challenging conditions, knowledge particularly relevant for rebuilding Germany's completely destroyed medical infrastructure, where literally everything had to be reconstructed from ruins. Treatment of combat wounds in camp hospitals exposed German medical personnel to American advances in wound care that had been developed through the war. The liberal use of antibiotics to prevent wound infections rather than waiting until infection developed, advanced surgical debridement techniques that removed dead tissue more effectively, and systematic approaches to wound documentation that tracked healing progress all represented improvements over German military medical practice. German medical personnel's observation of and participation in American wound care protocols influenced post-war German trauma medicine, contributing to improved outcomes for civilian trauma victims in a society where industrial accidents, automobile crashes, and other trauma remained significant health problems even after combat ceased. The American emphasis on preventive medicine in prisoner-of-war camps exposed German medical personnel to a different medical philosophy than they had practiced under military conditions. Routine health screenings to catch problems early, comprehensive vaccination programs to prevent outbreaks, and health education initiatives to teach prisoners how to maintain their own health demonstrated how effective prevention-focused medicine could be. This preventive approach, while not unknown in German civilian medicine, had received much lower priority in German military medicine, necessarily focused on treating battlefield trauma and acute combat injuries. Exposure to comprehensive preventive medicine programs that demonstrably worked influenced German medical personnel's post-war practice as they returned to civilian medicine, where prevention made even more sense than in military contexts. American rehabilitation medicine for wounded soldiers particularly impressed German medical personnel who observed it. The emphasis on returning wounded soldiers to maximum function rather than simply pensioning them off as permanent invalids represented a fundamentally different approach to disability and recovery. German medical personnel observed physical therapy programs that helped wounded men regain strength and mobility, occupational therapy that retrained them for new work when old capabilities were lost, and vocational rehabilitation programs that taught entirely new skills when necessary. These comprehensive rehabilitation programs exceeded anything available in German military medicine. This exposure to systematic rehabilitation influenced post-war German rehabilitation medicine development as the country faced integrating millions of disabled veterans into civilian life. American medical communication methods, encompassing communication between professionals, communication with patients, and medical documentation, differed noticeably from German practices in ways that German medical personnel found instructive. The emphasis on clear, comprehensive documentation that another doctor could read and understand, patient education that helped people understand their conditions and treatments, and interdisciplinary communication that brought different medical specialties together, effectively all provided models for more effective medical communication. German medical personnel's exposure to these communication methods influenced their post-war practice, contributing to more patient-centered and collaborative medical care in rebuilt German medicine, where the authoritarian model of doctor-patient relationships began slowly giving way to more partnership-oriented approaches. The experience of German prisoner-of-war medical personnel in American captivity ultimately demonstrates that professional identity can transcend even the most bitter national enmity. The American Medical Corps' decision to treat captured German physicians as respected colleagues with whom they freely taught and learned different medical procedures established professional relationships that outlasted the war and in some cases continued for decades. While the full extent of knowledge transfer and the complete network of professional relationships remains incompletely documented, with many personal stories lost to time and fading memories, available evidence confirms that German medical personnel experienced a level of professional recognition that exceeded their expectations and, in many cases, surpassed their previous experience in German military medicine, where ideological considerations always lurked behind professional interactions. This professional treatment was neither universal nor without significant problems and limitations. Security constraints necessarily limited how freely German and American medical personnel could interact. Language barriers complicated communication even when goodwill existed on both sides. The fundamental prisoner-captor relationship created an inherent power imbalance that affected every interaction. Some American medical personnel maintained professional distance from enemy doctors, unable or unwilling to separate their medical roles from their national allegiance. Some German medical personnel resisted American approaches, convinced that German medicine remained superior despite mounting evidence to the contrary, or simply unable to abandon years of professional training and practice patterns. Nevertheless, the documented experience of German prisoner-of-war medical personnel in America represents a genuinely remarkable chapter in military medical history that deserves wider recognition. The decision to treat enemy medical personnel as professional colleagues reflected both American adherence to international law and fundamental values within American medicine about professional obligations transcending politics. The impact extended far beyond individual German medical officers' personal experiences to influence post-war German medicine in ways both direct and subtle. While establishing precise causal connections remains difficult without comprehensive documentation, German medical officers who experienced American medicine during their captivity contributed meaningfully to post-war German medical reconstruction, bringing knowledge of American methods, ethics, and organizational approaches back to a country that needed to rebuild everything from scratch. The story of German prisoner-of-war medical personnel in America ultimately demonstrates medicine's remarkable capacity to maintain professional bonds and ethical commitments even during the most destructive war in human history. In treating enemy medical personnel with genuine professional respect, rather than merely going through the motions of Geneva Convention compliance, American military medicine not only adhered to international law, but also demonstrated values that transcended the immediate conflict. This historical example remains deeply relevant for contemporary military medicine and international medical relations in a world where armed conflicts continue to produce medical personnel who find themselves on opposing sides. The principle that medical professionals share fundamental obligations transcending national boundaries, demonstrated concretely in American treatment of German prisoner-of-war medical personnel, continues to guide military medical ethics and international medical cooperation. The German medical officers who experienced American collegiality rather than the expected enmity returned to Germany carrying more than just medical knowledge and technical skills. They carried the profound experience that professional respect could survive even total war, that medical ethics could transcend poisonous ideology, and that former enemies could become genuine colleagues united in medicine's universal mission of healing. That lesson, learned in prisoner of war camps across Texas and throughout the American landscape, helped shape German medicine's reconstruction and influenced how a new generation of German doctors understood their professional obligations to patients regardless of nationality, race, or political allegiance.